I'm Shay. This is gonna be my medication administration video for IV antibiotics. So I'm gonna start out by rolling the dice to see which medication I'm gonna be giving. So I'm going to be giving cefuroxime. So I know with that one, I'm going to be giving 500 milligrams. So I'm gonna write that right away for my dose ordered, 500 milligrams. And then when I open this book here, I'm gonna find out what I need to reconstitute it with. So it says with each 750 milligrams, it needs 8 milliliters of sterile water. And it says that it is okay to dilute into my solution here of the dextrose 5. Okay, so I'm gonna start out. I have, my order is 500 milligrams of cefuroxime, and I'm gonna divide that by the 750 milliliter vial I have, and times that by 8 milliliters, which is what we're reconstituting it with. And that gives me 5.3 repeating. So we're gonna do 5.3 milligrams per milliliters. And then I'm going to go ahead and do my next step of my calculation. So now that I have 5.3, I'm gonna be adding that to my 100 milliliter mini bag to get 105.3. And we're gonna divide that by half an hour, or 30 minutes, which is half of an hour. And we're gonna go 105.3 divided by 0.5 to get 211 is what we'll round up to. And we're gonna time that by the drop factor of 10 in 60 minutes to give us to give us 35 drops per minute. Okay, and so I'm just gonna make sure, perfect. So I have my label on there correctly. My calculations all done. So I'm gonna go ahead and do my first check. So I have cefuroxime, 500 milligrams for Anna Perry, perfect, at 8:0800, wonderful. So I have the right patient, the right time, the right dose, and it's an IV antibiotic, the right route, the right documentation, the right drug. And so my first check is all done there. So I'm gonna go ahead and I'm going to use my 10 milliliter syringe here and put 8 milliliters of air into it. So I'm gonna go ahead and draw back 8 milliliters, perfect. Sorry, I'm just gonna recap this real quick. I'm gonna make sure I weight my tops here. And allow them to dry. Perfect. Wonderful. So now I can go ahead and inject 8 milliliters of air into here. Just gonna confirm. Perfect. So I'm gonna go ahead in here and do 8 milliliters of air. And then I'm gonna go ahead and invert it and get those 8 milliliters back with water. Perfect. Me shaking. So now I have my 8 milliliters of water in there. Wonderful. I'm gonna go ahead and put that down. And then I am going to reconstitute it. So I'm gonna be adding this 8 milliliters of water back into this bottle of my cephalomoxime. And keep in mind, these are both already cleaned and dried. Going ahead. And getting all those 8 milliliters of water in there. Perfect. I'll go ahead and scoop. Perfect. And then I'm going to go ahead and roll this so we can get all the particles mixed up in there. Wonderful. Okay, and then I'm just gonna do, I'm gonna just fill up my 5.3 milliliters of my injection here. So I'm gonna pull back 5.3 on here, which is right in between that, the 5.2 and the 5.4 line. So there we go. And I'm gonna go ahead in there. And pull back. And there we go. Perfect. I'm going to go ahead and scoop this. Wonderful. So I have my 5.3 milliliters of solution there. I'm just going to go ahead and do my third check. Or my second check, sorry, not my third. So I have cefuroximine, perfect, 500 milligrams, wonderful. Anna Perry, IV at 0800. Got the right patient, the right drug, the right dose, the right reason, the right time, and the right documentation here. I'm just gonna double check all of my calculations here. So 500 was my dose ordered, 750 is my dose on hand here, times by that 8 milliliters we injected, perfect. I added my 100 milliliter mini bag to get 35 drops per minute. So I have my 5.3 here, just double checking that, wonderful. So now that my second check is done, I am going to go ahead and inject this into the mini bag. I'm gonna make sure I sterilize this port here first. And we're gonna go in like this. So that's there, and I have my 5.3 dose here. We're gonna go ahead, careful not to stab the side of the bag or ourselves, of course. Inject it into here. So now that that's all good, I'm allowed to put that down. Just gonna take off my needle here and put it in the sharps. And then I'm just going to make a medication label here. This can go in the garbage as well. So I have Anna Perry, room number 206. Drug she's getting is cefuroximine. She's getting 500 milligrams of that, added by Shea White, PNS, NIC. And it is currently at 0800. Flow rate is 35. GTT per minute. The date is January 20th. Perfect. Wonderful. So now that that's all good, I can go ahead and add this. And I'm just going to go ahead and do my final check before I dot my MAR and go to the patient's room. So I have my cefuroxime, 500 milligrams, wonderful. IV, 0800 for Anna Perry, perfect. Right time, wonderful. So I'm gonna go ahead and just pop that right on there. And then I'm going to dot my MAR. Perfect. So heading over to the patient's room, I need to make sure I have my 10 milliliter saline lock. Need to have an alcohol swab to be able to wipe the saline port. And I have my medication here. So I'm good to go. Hello, Anna. How's it going?
Good.
Good. My name is Shay. I'm going to be your nurse today. How are you feeling?
Not bad.
You're okay? Awesome. Do you mind if I raise your bed up here?
For sure.
Wonderful. And could you tell me your name and your date of birth?
Anna Perry, November 15th.
Perfect. Awesome. Wonderful. And do you know why I'm here today?
No.
So I'm just going to be giving you your IV antibiotics. So since you did just get surgery, we like to err on the side of caution and give you an antibiotic just to be on the safe side of things. So today you're getting cefuroxime. Do you have any questions at all?
Are there any side effects?
So there's not many huge scary side effects. A very common one is diarrhea, so please do watch out for that. And you shouldn't have any other side effects other than that. And like I said, it is a preventative measure. It doesn't mean you have an infection in your body at all right now. It's just erring on the side of caution in case you did. We want to keep you nice and healthy.
Okay, great.
Okay, awesome. So I'm going to go ahead and get started. I'm going to wipe their saline lock. Just like that. And then I'm going to allow that to dry for a sec. And then this is my saline flush. So now that this is all dried, I'm going to go ahead and connect that. I'm going to do it in just little spurts. And it's not going to work on the doll, so just showing you the motion I would be doing here. So I'm going to undo that. And then I'm actually just going to do this into the garbage for you. So I go. Just like that. Okay, so now that that's done, I'm going to be needing my IV medication. And my port is flushed and it is cleaned. So I'm gonna take this bag off here, flip it upside down so I don't get it all over me, take out that spike. That was really good. I'm gonna lean it up against something. There we are. And then I can go ahead and grab this. Once I take this blue cap off, I want to make sure not to touch that port at all. Cap will come off. There we go. Throw that out. I can go ahead and spike my IV bag here, just like that. Okay. Now I'm going to go ahead and invert it on here, just like that. Fill up my drip chamber a little bit. Perfect. And then I can go ahead and connect my tubing. And when I was flushing his lock, I was checking his IV site to see if there was any swelling or redness or anything that told me that I should not be continuing to put anything else in this IV. So I'm going to go ahead and take this cap off, connect this, lock that in place, and then I can go ahead and start opening some of my doors here. So I'm going to be trying to get this at about 9 drops per minute to match with the 9 drops in 15 seconds to match with the 35 drops over there that I got. So I do have my timer here. And yeah, we're just gonna take it out so that you can see it drip, because it will take a little bit. So I'm watching. Perfect, so that's a good rate there. We're going at 35 drops per minute. And I'm just confirming with my patient here that they're feeling okay. They didn't feel funny at all while that was going in. No?
Nope.
Awesome. And any questions at all for me?
No, thank you.
I'll be coming back to check up on you throughout and make sure that you're doing okay in here.
Okay,
And yeah, thank you so much for allowing me to give you your IV antibiotic.
thank you.
Thank you. Now that I'm back at the med cart, back from my patient's room, I'm just gonna sign the MAR since I just gave that medication. PNS and IC.